name is Alexis. I am an exercise science major with an emphasis in health professions and a minor in religion. I am an upcoming senior, and I have had the pleasure of working with Dr. LeBlanc in the biomechanics lab this summer. So I will be looking at the effects of muscle fatigue on muscle activity, joint angles, and ground reaction forces. I know it's a lot, but I'll go into detail a little bit. So here's a little bit of background. First off, by raise of hands, how many of you have played or are playing a sport in your... All right, cool, so a few of you. So, just a little bit of background. 3 to 5 million injuries occur annually, whether that be recreationally, professionally, or college, high school, whatever it may be. The most common type of injury is the anterior cruciate ligament, or the ACL rupture. So that is shown in the picture here. So if you see, here is a healthy ACL, here is a torn ACL. So what it does is it prevents the two bones from sliding across each other. So a lot of the times when this ligament ruptures, it's non-contact. So that means that it's something to do with the biomechanics of the person instead of, you're playing football, someone gets hit, and then you tear your ACL. Most of the time, these are non-contact injuries, which have been linked to findings of osteoarthritis in later years, which is not good, obviously. So many of these injuries can be psychologically exhausting, which is why sports psychology is such an important field to go in. Expensive because most of the time it's required therapy, surgery, painful obviously, and career ending. No one wants LeBron James to tear his ACL. That'd be good. So research questions. So it's very simple. I asked myself, how do the biomechanics differ from athletes and non-athletes? Why are these injuries so prevalent, especially in athletes? And what factors could be implemented to avoid these injuries? So if you see, some of these pictures depict movements in which it would put these athletes in a higher risk for tearing their ACL. So volleyball, basketball, football all have a jumping component. So what does the literature say? So what I did is I looked and I found a few articles. So Hewitt found that female athletes with increased knee valgus, which is basically referred to as knock-kneed, so when your knees kind of touch, and he found that these females actually had a confirmed ACL rupture in a few months' time. Brendel looked at patients with anterior knee pain, so that's just knee pain in the front of your knee, during ascent and descent of stairs, and found that they had a delayed and shorter activity of the muscle of the hip that determines how your knee is placed. Henriksen found that decreased activity in this muscle showed increased knee valgus during walking. So they're all kind of fitting together. So what I did is I asked myself, okay, well, what's missing? So I decided that my participant pool would include male and female athletes and non-athletes, ages 18 to 25, with no current injury that affects the way that their body moves currently. Participants will perform 3 drop landings. So basically what a drop landing is you stand on top of a box or some sort and you literally drop off. And you, depending on the person, their biomechanics will change of how they basically land and how they compensate for the force that goes into the ground. So fatigue of the muscle, if you look at the picture here, this is the muscle that we're looking at, so yes, you have 2. It's called the gluteus medius, and it is responsible for this movement here, which is called hip abduction. So what we will do is, instead of having the band here, we'll have it here to decrease the lever arms so they'll feel it in the right place. That was based off pilot studies, what worked. So they will perform this movement on each leg until they feel like they can't do it anymore. So fatigue is reached when they feel like, okay, no, I can't do anymore, that's enough. So electromyography, or EMG, will be used to measure muscle activity. So that's just the electrical activity in the muscle. So say I want to do a bicep curl, I put the EMG here and it'll tell me exactly how much electrical activity is in the muscle. Reflective markers in a video camera will allow me to look at the knee angles during their landing. So it'll look similar to this. So I will digitize their hip, their knee, and then their ankle, and they'll give me an angle during the movement. And then a force plate that will measure force in 3 dimensions. I will be specifically looking at the force, ground reaction force. So basically it's based off Newton's third law. The force that you put into the ground and the force that the ground exerts on you is what the value I will get. So hypothesis and anticipated outcomes. So based off the literature and what the literature has supported, so muscle activity, knee angle, and force reduction will show significant change after the fatigue of this muscle. The fatigue of this muscle is basically mimicking an undertrained muscle. So if if you have 2 people, one person that has a very well-trained gluteus medius and one person that doesn't, that is what the fatigue will mimic. So we will be able to differentiate between athletes and non-athletes during this movement because athletes are going to be the people that are predominantly taking part in these drop landings. Okay, so preliminary findings. So I have just finished my pilot studies. So I've seen that significant changes in muscle activity were shown after fatigue of this muscle, which is pretty expected just because it's so tired, it's not going to want to work. So other muscles have been picking up, for lack of a better word, the slack of this muscle. So muscles such as the gluteus maximus instead. Knee angle did in fact change. So after the fatigue of this muscle, participants showed more of a knee valgus, which I'll reiterate creates a higher risk for ACL injury. Force exerted into the ground also increased. I hypothesize that this is because you're tired, the muscle is tired, and you don't have as much to, let it be a more graceful fall. You're tired, you're just going to fall. So next steps. How can we incorporate training of this muscle to avoid these injuries? So exercise is important. Athletes are important. We want to protect our athletes. We don't want 3 to 5 million injuries a year. So how are we going to counteract that? It's not just, like I said, hey, you play football, you're going to get hurt. No, these are injuries that can be prevented and should be prevented. There shouldn't have to be an 18-year-old that tears his ACL that has to worry about osteoarthritis later in his life. So these are some, actually, exercises if you want to go home and train your gluteus medius today. These are some exercises that you can do at home that would train this gluteus medius. So yeah, looking forward, some studies would include looking at different types of athletes from different types of sports and determining, the differences between that. So obviously some sports have trained certain muscle sets more than others. So yeah. So acknowledgements, I'd like to thank Dr. LeBlanc. You've been such a great help. Dr. Owens and Dr. Alcoya, my fellow biomechanics lab mates, and their co-host.
Great job, really interesting. Quick question, in your review of the literature, did you find anything about, it was interesting what you mentioned about the knock knee being a contributing factor perhaps. Have you found anything about hyperextension of knees contributing or protecting ACL injury?
Hyperextension instead of the knock knee?
Yeah.
Nothing in particular. If anything, when you're landing with more of a flexed knee instead of an extended knee. If you were landing extended, I think that would be a whole different type of mechanics that you would have to look at, a different type of ligament that you'd have to look at. Yeah.
Are any, because I know you showed that it's on the side of the thighs, is there anything closer up to the hips, like say someone just has smaller hips or something like that, would that affect them or the likelihood of them getting an injury?
Yeah, so everyone's body is different. You have to look, like I'm taller, so if you think about it, my gluteus medius might not have as much an effect because of the lever arm. So it's basically like if you were to try and pick something heavy up close to your body, it's much easier. Whereas if you were trying to pick it up with extended arms, so that's kind of what a lever arm is. So I think the mechanics and the anatomy from person to person definitely changes. So there's lots of variables to look at, which is why I think it's so important to pick one key component, which is what I didn't find in the literature to use. So I said, hey, let's look at it. Ask me some questions. Yeah.
How did you choose your age population of 18 to 25? Is that based on just the people that you could get in, or is that based on something you might have found in the literature?
Yeah, so 18 was to kind of avoid the whole child having to assent thing.
Yep. Okay.
And then from actually some classes that I've learned that age 25, despite popular opinion, is when VO2 max, muscle atrophy, bone density starts to decrease. So I thought I'd just swap that out. Yeah.
So one of the things in my short time here in California that I've noticed is that the older population is very active, impressively active here. And you know, we have a retirement community right across the way. I think you should think about your research a little bit further to examine other populations. While it's great to examine the 18 to 25-year-olds, those of us who are looking more towards the future years would like to get more information about the older populations as well. So you have a sample of a population right here available. So
Yeah.
think about expanding your research to that group.
Yeah, actually I'm a physical therapy aide, so I work with a lot of these older populations, so I do see what they can do, and I think it's very important to.
And what I've been seeing is fascinating is that many of the older populations in this community are doing much better physically than the younger
Yes.
population. So I'd like to see some comparison in your future work.
Yeah, thankfully we live in a very active community.
Yes.
So, yeah.